Congenital heart disease is something that somebody's born with. So it happens when the fetus is still in the mother's womb and in development. And the definition is really dependent on the fact that something happened in formation of the heart. But it can be a range of defects, from very simple defects to very complex defects. Sometimes we know what genes cause congenital heart defects, and we can isolate these and actually can have an idea very early on what the risks are if, say, a mother has congenital heart disease, what the risks are for the fetus. But sometimes they're just sporadic and we don't know. Some of them are autosomal dominant with incomplete penetrance, which basically means that if a relative has it, there's a chance that the fetus could have it, but we don't really know exactly whether or not that fetus will develop congenital heart disease. We can actually find the DNA now in the maternal blood, and we can have a good idea of some of these defects early on. We also recommend that these women have echocardiograms of the fetus, so the fetus has an echo well before the child's born, somewhere between 20 and 24 weeks usually. Then we have an idea of the fetus's chance of having heart disease too. So we like to see the mother early on, and the reason we like to see the mother even before she becomes pregnant is because there are certain defects that put her at higher risk and the fetus at higher risk in pregnancy. And so we want to be able to counsel and go over the medications and talk about what are the risks of, first off, the mother having a baby with congenital heart disease. So there's about a 2% chance in the overall population of having a child born with congenital heart disease. But that doubles for most of the congenital heart defects if the mother has congenital heart disease. There's not that many specialty clinics in adult congenital heart disease in the country, which is unfortunate because there's now more adults living with congenital heart disease than children. And that is a wonderful thing. It just happened because of the surgical advancements, many of them by Lillehei here at the University of Minnesota, that allow these children to survive. And so unfortunately, there's not a lot of specialists that have been able over the time to grow with the growth of this population. So a lot of them are cared for by primary physicians or sometimes even their cardiologists from childhood. So our clinic is unique in that there aren't very many of these clinics in the country. We have one here at the university where we see patients. We've seen over 600, and then we have outreach clinics at Southdale, as well as we're starting one in Duluth and at Riverside.